for it everywhere. Let's delve into the outpatient opportunity. When we're setting up outpatient urology clinics, or let's talk maybe just about your office days, what does that look like for you?
So any patient that needs follow-up, I'm particularly fellowship trained in FPMRS, so incontinence and pelvic reconstruction, had a large population of patients who were just medication follow-ups, every 6 months or every year. Those patients, you don't have to lay hands on those patients. If they're emptying their bladder and they're doing well on medication, that's a perfect telehealth appointment. Recurrent urinary tract infections. If you're treating somebody for recurrent urinary tract infections, those are also appointments that can be done by telemedicine, because if they do actually need a urinalysis, well, you send the order to the lab and they go to the lab and get it done, or they come into your office and drop off their urine. If your office is one that allows that sort of thing, you just put in the order and they stop by at their convenience. Any sort of evaluation of stones or renal masses, those patients can even be seen by initial new patient visit by telemedicine, because in those instances, you don't need to lay your hands on that patient. I mean, let's be realistic. You don't. You're looking at the imaging. The imaging is generally going to tell you if it's suspicious for renal cell carcinoma. And at that point in time, you set them up for surgery, or you set them up for interventional radiology consult for ablation. If it's a kidney stone, you look at the imaging, you see if it's an urgent situation. If it's an obstructing stone, okay, you get them set up for surgery. If it's a non-obstructing stone and it's going to be an elective procedure, you still get them set up and you're able to talk to them, as you said, uninterrupted. You can go over the risks and benefits. So these sorts of things lend themselves in a very lovely way, which allows you to get more patients seen, especially for initial new patient visits. And the more rural areas that have a backup and a backlog of patients, it allows you to get patients seen more efficiently, in a more timely fashion, and it allows you to utilize the staff that you have in the office for procedures at the time, while your APPs or I like to call them spare urologists, so the urologists that are seeing people by telehealth, that's all they're doing. That's all your APPs are doing, is seeing by telehealth, while the office is reserved for those things that absolutely need to be done in the office, like cystoscopies and rectal exams and various procedures like prostate biopsies.
Absolutely. Absolutely. And I think, when we really look at this, from the holistic picture, we're delivering safe, effective care. The patients are being seen, in all honesty, in a more timely manner. I do think the collaborative care is the way that we're going to move forward, right? By incorporating nurse practitioners and physician assistants into the constant practice of urology.